When you're counseling patients about diet, is there one diet that works well for most, or is it like really to where you're going to be individually looking at diets like person by person? And for some patients, you mentioned the ERD patient, you may have to like eliminate your alcohol. Like, how do you think about that kind of prescribing dietary changes for your reflux patients?
I think a big thing I try to first get them to is much more of a whole food type diet as opposed to processed food, something out of a box or a can. And then reading labels. It's amazing how many people don't read the labels, have no idea what's in the food. I mean, there was the one study that looked at Mediterranean diet and alkaline water being as symptomatically beneficial as a PPI. And so I do try to steer more towards a Mediterranean diet and then counsel them that doesn't mean all the pasta you can eat. It's just more fish-based and vegetable. And as one show I had seen on one of the streaming platforms, and it was always this like, eat a healthy diet, mostly plants, sometimes meat, that type of thing. With AERD patients, they actually benefit from studies from really high omega-3 type diets because of the anti-inflammatory component of that. And so let's get rid of the processed food. Let's get rid of the added sugar. Let's get rid of a big source of red meat and omega-6s and start there. And then it's just a matter of portion control and timing. And like, you can eat certain things, but maybe not at 10 p.m. Then we dig in with some people about like, well, could there be dairy issues or gluten? And we could have a whole other podcast on non-celiac gluten sensitivity, but that's beyond that scope today. But, we dig into that stuff though, too.
So basically, in general, getting rid of processed food as much as you can and trying to eat food that looks like what it is. You can tell by looking
exactly
at the ingredients. A carrot is a carrot, and there's not 100 ingredients that you can't pronounce on the packaging. Okay, so there's the diet part of it. You mentioned not eating late at night, so giving your stomach a chance to empty before you're laying down. Does that matter? Is that a pretty significant part?
Yeah, that's a big part. I mean, 3 to 4 hours from your last meal before you lay down. I talk to patients a lot and I say, like, I don't mean before you go to bed. I mean before you lay down, because then there's everybody who's lying in bed watching TV, crumped up, abdomen folded like an accordion on pillows, watching TV, for 2 hours. And so I just say, it's like, stay upright for a couple of hours. And when you're lying down, it's getting maybe on a little ramp or head of bed elevation, but not on 5 pillows where you're crunching the stomach. And then sleeping on your side, left side down, has been shown to improve or decrease reflux events and those types of things. It's funny because I was talking to one of my residents and he just happens to be Jewish, but we were just talking about how he was saying even the Talmud, I think, I may be getting this wrong as to which book it was, but he goes, well, it says like you should sleep on your left side. And yogic and Ayurvedic medicine says sleep on your left side. Modern medicine for reflux says sleep on your left side. Like, this is something we've known for thousands of years, right? But like, now we're counseling patients about it and they're all like, oh, I should sleep on my left side. And you're like, yeah, it turns out everybody thinks left side down is better. Yeah, this just in. Yeah.